Hello and good afternoon. Welcome to Choosing Cabinetry that brings value to your clinical environment, a webinar brought to you by Medical Construction and Design and presented by Midmark Corporation. At the conclusion of today's presentation, we will take your questions. At any time during the presentations, you can type your question into the text box screen and then press enter. Questions will be read aloud, and we will try to get to as many as possible. If your question is not answered during the event today, our team will circle back and respond to you after the webinar. If you look at the event window under handouts, you will find three. There is an infographic, cabinetry considerations checklist, and a cabinetry brochure. Our speakers today are Tracy Timmerman, Senior Marketing Manager at Midmark and EDAC certified. Brian Hazelwood is joining us and is the Marketing Manager at Midmark and is also EDAC certified and has an MBA in marketing from the University of Cincinnati. And again, we welcome you and like to turn it over to Tracy to take it away.
All right. Yes, thanks so much, Sherry. We just appreciate you having us today, and thanks to everybody who's joining the call. We hope your week's going well. So Brian and I, we're going to be discussing something that is oftentimes it's either just overlooked or maybe it's underappreciated in the clinical space, and that's cabinetry. And it's not just how it's designed, but it's also how it plays into the overall workflow and design of that space. So here at Midmark, we have product design experts, and they're out visiting healthcare facilities all over the country. So we're visiting thousands of exam and procedure rooms. And our teams, when they're out there, we're speaking with staff, doctors, facility leaders. We're trying to identify issues, and then we start to ID some trends that maybe aren't being addressed. And then we work to develop solutions that can help address them. And what we're seeing is that cabinetry that's used in exam and procedure rooms, it is starting to be seen more and more as an integral part of the clinical environment, because what we're finding is how that cabinetry is designed and utilized within the space, it's going to impact the overall workflow efficiency. It can influence safety initiatives, and the healthcare experience is really impacted for both the patients and the care teams. So some of the features that we're going to touch on today include proper ergonomics and how that can help reduce injury and fatigue. We'll talk about an organized space with optimized workflows and how that builds in efficiencies. We'll also touch on materials and structures and how that helps with infection prevention. And then finally, we'll hit on flexibility. So we're seeing the need for spaces to be more and more flexible to accommodate changing room layouts or expanding clinics, or even sometimes we see the flexibility that is required when people are moving facilities. So that's kind of a highlight of what we'll cover today. But before we go too deep into those features, I'm going to hand it over to Brian to help us just better understand kind of that typical current state of the construction design process. So Brian?
Thank you, Tracy. Whether it's a new build or remodel, healthcare facilities address cabinetry and storage during the design process. They spec them during the design phase and purchase them during the construction phase. During the design phase, decision makers work with architects to design the space. Once that space is finalized, they turn to a general contractor for the construction process. The general contractor will bid parts of the build, cabinetry to subcontractors, and then selects a bid representative of the design. Unfortunately, many times today, cabinetry is seen as a commodity, and with budget concerns or cost overruns, often the bid selected is the lowest cost option. That lowest cost option is typically millwork that is made of veneer sandwiched particle board with PVC edge banding. It is the same cabinetry found in entry-level bathrooms or kitchens. While lower upfront costs on cabinetry may seem like an easy decision, there can be additional associated costs with low quality cabinetry that is not designed for the medical environment. The negative consequences can be improper ergonomics that can increase caregiver injuries, inefficient workflows that can waste valuable time in the exam process, poor infection prevention due to gaps or materials breakdowns that can harbor pathogens, and this together leads to space that does not function for patients or caregivers. Another current concern is personnel shortages. If we look at the yellow line in this chart, medical personnel shortage is the highest concern in healthcare today. This is the first time this has been the case since 2004. One reason is caregiver burnout. During and after COVID, caregivers have been asked to do more than ever while being tired, fatigued, or even have fatigue-related injuries. On any day, work in a clinic can be physically and mentally demanding. It is not uncommon for caregivers to go home with neck or back pain and sore muscles and joints. This is often the result of caregivers working in uncomfortable positions, utilizing poor ergonomics while accessing supplies, interacting with patients and equipment, or entering electronic medical records. So how can we improve the caregiver environment? There is no simple answer, but improvements in the design of the clinical environment can help. By applying evidence-based design, you can help improve things like ergonomics, organization, infection prevention, and even the flexibility of the space. This can help improve safety, efficiency, job satisfaction, and the patient experience. These can lead to ongoing savings for clinics. Tracy will now discuss health and design concerns faced in clinics today.
All right, thanks, Brian. Yep, there's several concerns that we'll touch on, but first we're going to just start with ergonomics. So when we consider an ergonomic design, you'll find that those challenges are quickly going to start presenting themselves. I think we've all experienced those moments when we sit in a poor posture and we pay for it later, right? It's uncomfortable and painful. And it's the exact same thing in the clinical space. An uncomfortable working environment that can have a negative impact on the healthcare team, as well as their productivity and efficiency levels. It can also just create a dissatisfaction among the staff, hurting employee retention and making that hiring effort even more difficult. So as Brian mentioned, those staff shortages, that's the #1 concern for the first time since 2004. So we really do have to pay attention to this. If we have improperly designed spaces and staff are forced to use those poor ergonomics, burnout is just going to get worse. And if you look at caregiver fatigue, that can potentially lead to inattentiveness and errors, which could lead to a negative perception in the minds of patients that quality of care delivered is just not quite up to the expectations that they have. And then increased fatigue and injury, that can also raise absenteeism, causing frustration for both patients and clinics. So there was a survey conducted by Medscape that revealed that nearly 2/3 of doctors in the US are feeling burnt out and depressed. And those feelings affect how they relate to patients. 1 in 3 depressed doctors said they were more easily exasperated by patients. 32% said they were less engaged with their patients, and 29% acknowledged just being less friendly. So this is getting right to the heart of that care experience. That relationship between the patient and the caregiver, it's built on a foundation of trust, engagement, and understanding. And the design of that space has to support the caregiver so then they can do what they love and focus on their patients. All right, so on this next slide here's an image of that shows a typical design for cabinetry configurations in the reach range. So today, what we've found in our research is that 76% of the healthcare workers are female, and their average height is 5'4". And most of the cabinetry out in the spaces that we see are not designed for these 5'4" females. Most of the time what we're finding is the cabinetry is this traditional, what you see on the right here, the cabinetry is a traditional millwork overhead, and they're 84 inches tall. So if you look at these 84-inch tall cabinet, this 5'4" female, there is no way that she can see the top of that shelf, let alone access it. She really only has access to about 27% of the storage area unless she goes to grab for a stool, or she's going to use poor mechanics to put excess strain on her, whether she's leaning or reaching. And also that space, that's just hard to see and access, that space up at the top. And we often find that this kind of becomes a cluttered space and just becomes a little bit of a catch-all. So we want to make sure that we're, again, designing for proper ergonomics and good organization. So overall, what we're typically seeing, those 84-inch tall cabinets, is just really not an acceptable design for our care teams. I think the next slide will show some of the statistics here, statistics that really show the impact. So 1 out of 5 injuries are reported in the US are healthcare related. And the frequent pain areas are the neck, back, shoulder, and wrist, just stemming from that poor posture. A lot of times what we see in the exam room are clinicians, they're wanting to maintain that eye contact with their patient. So they sit on a stool, they're facing their patient. Often we'll see them with a laptop on their lap. Maybe they're putting their feet on the feet of the stool, and they're hunched over trying to, keep record on their laptops while maintaining that eye contact with their patients. So again, the space isn't designed to support them the way they need to be supported with good ergonomics. And then this next slide, the next stat here, I think was the most staggering to me. Healthcare workers are 3 times more likely to be injured every year, even compared to construction workers. So that was very surprising when I first heard that statistic. And of course, there's a cost to all of this, right? So the average cost per incident for strains and injuries is $65,000. So definitely a cost that we want to avoid when we're designing the space appropriately. All right, and then the next challenge that we'll talk about is poor organization. This is another challenge that's just frequently faced when not effectively considered in the design of that clinical environment. Again, we're out speaking with clinicians across the US, and one of the main issues that those clinicians are telling us that they constantly encounter is the need for adequate and accessible storage space right at the point of care, right at their fingertips. And just note that I said adequate and accessible. So if you think back to that 84-inch tall cabinetry that we often see, that might be adequate, but it's certainly not accessible. They can't reach that high, it's too tall. So I definitely want to avoid that. And then some facilities, they just have limited storage space depending on the size and configuration of their rooms. And that can often have a negative impact on the experience and the quality of care delivered. And the effects of that unorganized or inadequate storage space can be far-reaching. So if staff don't have the supplies that they need where they need it, there is going to be an impact on efficiency. And this can set back the initial visit for the day, and then the wait times can just get longer and longer, and it's going to compound throughout the day. I think we've all experienced, being in that waiting room or waiting for a while. Maybe we don't know how long we're going to wait, and the frustration just continues to build. And that can impact the patient's perception and experience. And then additionally, if supplies aren't properly organized and managed, a couple things could happen. You may run out of supplies that are needed, or on the flip side, you may have supplies that become outdated and just need to be purged, creating waste that we want to avoid. All right, so there could be a number of reasons why the healthcare facilities and organizations are challenged with this inadequate space. So that could be maybe the storage just wasn't a major consideration during the design phase. There's a lot of things to consider, so maybe storage just wasn't one of them. You could be working in an older facility that wasn't originally designed to handle continued growth and increased volumes. Perhaps the cabinetry and storage solutions that were initially designed weren't designed for the medical environment, or maybe your patient or provider demographics have changed. But really, regardless of the reason, that cost of inadequate storage can negatively impact both the clinic staff and patients. So for the clinic staff first, you think about that, the inadequate storage, it can really hurt productivity levels. Along with having to hunt, along with having to just work in cluttered spaces, the clinical staff have to contend with unorganized inventory. So what we see is needed supplies are often they're just stored outside of the exam room because there's limited space, or maybe that valuable space is being unused because it's just not accessible. And then as a result, caregivers, they can find it hard to find the supplies, or they may be running low and they have to spend extra time going to an overflow closet to find what's needed. And there's actually one study that shared that there was approximately 66% of a nurse's time is spent searching for supplies. But in some instances, such as Johns Hopkins Hospital, they did some work to focus on this, and they estimated to start that those activities actually took 20% of a nurse's time. So with limited staffing already, those spaces need to be designed to allow them to use their time just as productively as possible. And then if you focus on the patient experience, patients, they also want assurances that the steps are being taken to create a safe and inviting healthcare environment that can assist with just providing quality care. There was actually a Gallup survey found that it says that patients tie clinic cleanliness to quality of care. So at first that might not seem obvious, but inadequate storage at the point of care can have a negative impact on the patient perception. So just at the very basic level, those cluttered areas and supplies, if they're strewn across the exam room, that's going to appear unprofessional, unorganized, or even dirty. So this image can really influence how patients view the quality of care that's being delivered at the facility. Okay, and then we'll flip over to infection prevention a little bit. So it is important that cabinetry is designed to just withstand the rigors of daily use in those non-acute environments. But you also want to balance that clinical functionality and aesthetics too. I mean, we certainly saw the need for durability during the pandemic. I think as everyone did, there's increased cleaning protocols, very harsh cleaning agents being used. And when we try to meet, just cost pressures by utilizing low-cost laminate cabinetry, that can quickly start to expose patients and the clinical staff to increased levels of contaminant because you're going to have those gaps or those seams that are found at the edge banding and face surfaces of that laminate cabinet. And then we also have to be cautious of moisture damage and deterioration issues. So those wood cabinets, they're just going to break down faster among rigorous cleaning protocols using those medical grade cleaners. And what that cleaning is going to do is it's going to cause splitting and cracking and then swelling around those joint areas. And overall, this is just going to shorten the lifespan of the cabinetry. And it's also going to harbor contaminants, again, exposing patients and clinical staff to that further risk. All right, and then we have our next poll question. So what is the percentage of MDROs acquired in the non-hospital setting, like an outpatient facility, clinic, or primary care office? So there are your options there: 70%, 54%, 25%, or 30%. We'll give you a few seconds there to put in your polls. All right, so here's the vote. So majority said 54%, but and the next one was 30, and then split evenly between 70 and 25. So the correct answer is actually 70%, which I think is surprising because I think people's natural reaction is that those HAIs are being acquired in the hospital space, but it is actually in that non-acute spaces. So on this next slide here, that just shows that statistic. So this was a study of HAIs that was performed by Intermountain Healthcare. And that study included 22 hospitals and their affiliated clinics, and it was done over, I think, an 8-year period. And there was about 4 million patient encounters reported. And the results were 70% of those MDROs are originating from that ambulatory setting. And similarly, 70% of MDROs detected on admitted patients were attributed to acquisition in that non-acute space. So again, really need to make sure that we are focusing on infection prevention in the non-acute space. And doing that with the cabinetry design as much as possible. So we want to avoid any seams and porous surfaces on those high touch areas like traditional millwork that can harbor those contaminants. And then also liquid disinfectants, it's just going to have a hard time to reach into those seams and pores, so they're really hard to clean. And when those contaminants are harbored in those areas, it just increases the risk of that contamination. So certainly something we want to design to. And also, this is just an interesting slide because I mean, obviously everybody knows that cleaning is important, but it's also important to consider how long these pathogens are living on these surfaces. It can be anywhere from days or weeks to many months. So again, anything that we can do to design for that infection prevention or making it easier to clean, like avoiding those pores or seams, is certainly something that we want to design towards. All right, and then the final challenge I'm going to discuss on cabinetry is just the lack of flexibility required by the clinical spaces. So today, most cabinetry that we see, it has to be assembled and then it's permanently installed into the room. So it can be very difficult, if not impossible, to alter or move that cabinetry. So for a clinic's remodel, or maybe you're trying to change physical locations, what usually happens is that cabinetry ends up going to a landfill and is just replaced by new. So really want to make sure that we're designing, thinking futuristically and making sure that we're designing as flexible as possible. So next, Brian now is going to discuss how that cabinetry designed for the clinical space can help improve safety, efficiency, satisfaction, and outcomes overall. So Brian, I'm going to hand it over to you to show how everybody is working to address those challenges.
Thank you, Tracy. As Tracy just went over all this and took you down the road of some of the problems that can be, what we want to talk about that it does not have to be this way. We can improve patients' spaces so they function better for the caregiver, the patient, and the clinic itself. Many health systems today use this quintuple aim approach to address some of the challenges that Tracy just reviewed. The quintuple aim has 5 elements seen here, and cabinetry design can help address them. Designing cabinetry that is built to last and withstands most medical cleaners can reduce costs long term. Next, using proper ergonomics can improve the care team well-being with less strain injuries. Health equity can help improve, can be improved by designing for requirements such as ADA accessibility. The patient experience can improve with a well-maintained and organized space. The caregiver can focus on the patient instead of searching for supplies. Finally, by improving the experience between the patient and caregiver, as well as designing for the accessibility, population health can be positively impacted. In the following slides, we'll review this in more detail. That's it. Here we see a cabinet rendering. This cabinet is designed with the back up one. Okay, there. This cabinet is designed with a focus on ergonomics and can aid in improving caregiver safety. This is done by having improved visibility that's safer and easier to access. Earlier, Tracy showed how with a standard cabinet configuration, a 5'4" tall staff member could only reach 27% of the available storage space. This hanging cabinet design allows more access for the average height user. This can help lower injuries and costs, but also make caregivers feel more appreciated. As we move to the next slide, from that rendering, we can now see an image with a cabinet and a caregiver. This design shows an improvement in access. Recall that 76% of healthcare workers are female, who average just under 5 feet 4 inches. Wall-hung style cabinetry like this helps keep staff inside of the appropriate ergonomic reach range with the focus on reach and visibility for that average caregiver. Our research has shown that the bottom drawers are not used or become catch-alls. So in this situation, we've taken the product off the floor so that it's you don't have to stoop, and it's also easier to clean underneath the product. If you have more usable storage space, you can improve efficiency through organization. Supply organization is patient-centric focus, as a caregiver can now easily find supplies and have more direct interaction with the patient. Caregivers do not have to be searching 6% of the time, as Tracy mentioned. We have seen organization solutions in common spaces, such as kitchens, closets, and garages. If you could, why wouldn't you use more organization like this in patient spaces? Staff can be more efficient and feel like the space is designed to support them, so they can focus on the patient. Patients can feel safer and that they get better service in an organized space. Recall that Gallup survey. Tracy mentioned how patients equate cleanliness of the clinic to quality of care. So what does clinic space organization look like? Here we see cabinetry with sloping shelves and bins and with drawer dividers. This allows for supplies to be organized, visible, and easy to find. This style of organization also helps support lean 5S supply management. If you use the same location in each exam room, each caregiver knows exactly where to look for a product. This saves clinicians searching time and again improves the face-to-face time with patients. As we move to the next slide, it is not just cleaning protocols that make patient spaces aseptic. Cabinetry, furniture, and equipment designed with infection prevention in mind can improve upon cleaning and making spaces safer against the spread of healthcare-associated infections, or HAIs. Recall, infectants can remain for many months on surfaces in a room. Designed for infection prevention means there are less gaps, smooth finishes, materials that withstand medical cleaners, and even antimicrobial materials. This can help lower the chance of infections harboring and HAI acquisition by patients and caregivers. What are some of the characteristics of infection prevention and design? To the left, you see one-piece tub drawer designed with slide covers to protect against spills, and it is easy to thoroughly clean. Seamless thermofoil wrapped around the outside of the cabinets reduce gaps and is easier to disinfect. To the center image, it shows more of a millwork style cabinetry. You see 5-piece drawers with gaps, veneer covered particle board with PVC plastic edge banding. Inside and outside may have gaps or seams that can harbor infections here. Being off the floor, wall-hung cabinetry also allows easy wall-to-wall cleaning. This is better for disinfecting the space. Today, modular is being used more in buildings and internal spaces. Modular for a building helps lower upfront costs. Internal room flexibility can help with the repurposing of space for market demand changes. Telehealth was infrequent prior to COVID, but is used more today. Many clinics have telehealth rooms or dual purpose rooms to make it easier to perform telehealth calls. And that's just an example of flexibility and changes based on market demands. Cabinetry that is modular in design is easily configurable and can seamlessly integrate into existing workflows to help maximize available space. Modular is also more inductive to expansion, repurposing, or even movement to new facilities. Due to this, many healthcare systems today are approaching projects with a modular design. As an example, a recent system discussed with us how they were able to repurpose existing cabinetry in a move, saving them money and keeping the cabinetry from going to a landfill. Another tool for flexibility are medical carts. Here you see a mobile treatment cabinet that is designed to dock under the countertop and then can easily move to bring supplies to the point of care. It can also serve as an additional work surface positioned anywhere in the room. A few usage examples are a clinic may have 1 or 2 days a week for a pediatrician, and they could have their one patient-specific cart put in their room for them. Or you could use it for restocking. So you keep rooms available by swapping out a cart that needs restock with a full cart. Here we will look at some illustrative examples of changes in cabinetry configuration. In the left image, you could add a middle cabinet, perhaps for more storage needs. In the top right image, you can change door style or drawer location. within the cabinets. In the bottom right, you can reconfigure cabinets that may improve the flow in an exam room or procedure room. Tracy will now discuss space design tools and manufacturer installation that is available.
All right, thanks so much, Brian. Yep, so definitely a collaborative effort to design the clinical space. And today, what many manufacturers are offering design and project management services to just help ensure that those projects are completed on time and just with minimal changes. And there are virtual live design sessions where you bring in room designers and architects, and that can just help streamline the communication with the clients and just make that design fluid. You can make edits in real time. So this process is going to really reduce the number of revisions and just ensure that that room design complements the clinical workflow. And then additionally, to help drive consistency from all the way from design to the installation of the product, and then finally all the way to the delivery. Delivery services can just help with the delivery details, all the pre-installation, preparation, and installation guidance. So ultimately, this works to create just that turnkey delivery and installation solution that will save time. It's going to help lower labor costs and help meet those deadlines throughout that construction process. So definitely some good services to look into and take advantage of. All right, and then we'll wrap up on the next slide here. There we go. Okay. All right. So as we wrap up today, hopefully we provided just some thought-provoking insights as to how cabinetry designed for that clinical space can support the quintuple aim framework, which works to optimize health system performance and ultimately drive success and good outcomes. So what we've discussed today, we've discussed how cabinetry can be a part of many aspects of that success. So you have those ergonomics to aid the user, making their job easier and ultimately working to lower those injury rates. We want an organized space to optimize and increase efficiency right at that point of care. And then infection prevention, we want to design with that in mind for safety and just a feeling of security for both your patients and the staff. And then finally, flexibility. We need that flexibility to move, add to, change, or reconfigure the cabinetry. So those are the four things that we really highlighted today, some challenges and how to address those challenges. So again, thanks so much for having us today. We hope we brought you some valuable information. With that, I'll hand it back over. I think we have some questions.
Thanks so much, Tracy and Brian. That was really a fantastic presentation, and I'm sure the audience really enjoyed that. With that, we're going to open up the floor for questions, and we would really appreciate if you have any questions in the audience, then please feel free to pop those into the questions field. We're going to start with a question for you, Brian. Sam is asking, can you explain why having a manufacturer help with design, installation, and project management can help with construction and post-occupancy outcomes?
Yes, thank you. I think what you want to ideally is have a cross-functional collaboration on a project with architects, designers, manufacturers, even like members of the community and obviously the healthcare system staff. And a company like manufacturing products for that environment, they will know medical products anyway, will know regulatory and technology requirements that are needed. And so I think that can be a big benefit to help in this situation. Ultimately, the solution needs to bring all these people together to collaborate to come up with the best experience and outcome for the patients.
That's great. Thanks so much, Brian. Tracy, we have a question for you. The next question is, how much research should be done before starting a new project?
Gosh, no, that's a really good question. If you're not already familiar with the Center for Health Design, I think I would really recommend getting familiar. They support an evidence-based design process, and they have a lot of tools on their website that can help you get started. There's also what's called EDAC. You heard Brian and I both have those certifications. It's just evidence-based design accreditation and certification. Several Midmark teammates have that accreditation. And it's just certifying that those individuals have that knowledge and expertise to help work that research into the built environment. So happy to support that. But yeah, bringing in anybody with that knowledge or expertise would be helpful. And then of course, the Center for Healthcare Design is a really good tool. They have some really nice toolkits on their site.
Great, thanks so much, Tracy. And we have another question for you, Brian. Have you had any success with moving cabinetry from one location to another?
Yes, I mentioned before we had a recent one that we've done with we worked with architects on a project customer that had outgrown an existing facility. During the planning, we suggested they reuse their existing cabinetry because it was modular and could be moved. They agreed with that and then went ahead with the move, and it ended up saving them $40,000 because of using that existing cabinetry along with some new cabinet that they buy. But it also helped, the savings, like I mentioned, but also their sustainability benefits.
Yeah, it's something that I'm not sure that everybody considers, but certainly worthwhile looking into. With that, I think we're done with our questions for today. I would like to thank you again, Tracy and Brian, for a terrific presentation. And if the audience would like to watch a replay of this webinar, it will be found on the Medical Construction and Design website in the next week at mcdmag.com/webinars. Thank you again for your participation, and we hope you have a great rest of your day.
Yeah, thank you.
Thank you.
Let's just